The full extent of the COVID crisis facing the NHS has become more apparent today. More than 50,000 new cases were reported in the past 24 hours. That's yet another record for the UK and a matter of extreme concern, according to Public Health England. The head of the NHS in England says that health workers are once again in the eye of the storm, while a leading scientific advisor to the UK government says urgent action is now needed to prevent what he called a catastrophe in the new year. Any changes to England's tier restrictions will be announced tomorrow. Our health correspondent Catherine Burns has the latest.
We all wanted to have a few days off over Christmas, but instead have been asked to come back to work.
This time it's a wave. This time we've seen a massive increase.
If we continue with the current rate of admissions, we are very, very close to becoming overwhelmed.
So it is affecting anyone and everyone.
People are just beginning to be exhausted. It's been such a long year.
Doctors and nurses from the NHS frontline telling us what it's like dealing with a pandemic that after months and months of hard work is getting worse. Queen's Hospital in Romford today, 20 ambulances waiting outside, some on double yellow lines because the parking bays are all full. At one stage, you can see staff bringing hot drinks out to patients waiting in the ambulances. The hospital says they were being cared for safely, but that it's under considerable pressure and is asking staff to take extra shifts. It's a similar picture across London and the southeast of England.
I'd say this is the most challenging extended period that I've ever seen, and I'd like to just take the opportunity to pay tribute to the staff who have worked phenomenally hard and well.
More than 21,000 people are being treated in hospital for COVID across the UK. In Wales, they're dealing with their highest level of patients now.
The patients who are coming to ITU now are a degree sicker. A lot of them are desperately unwell. And we've seen a real reflection of that in the amount of patients that have died.
In Northern Ireland, hospitals say they are under pressure but coping. And in Scotland, people are being asked to stay at home over New Year as cases hit a record high. This new surge in cases couldn't come at a worse time of year for the NHS. Winter always brings extra pressures with more respiratory illnesses, as well as slips, trips and falls in icy weather. This year, on top of that, and the pandemic, social distancing means hospitals need to keep patients further apart. And the NHS in England is operating with around 10% fewer beds than usual. In England, 24 million people are already living under Tier 4 restrictions, the highest level. The government is about to decide if that's enough. And this warning from a scientific advisor: act now to avoid catastrophe in the new year.
In my view, if we don't introduce tougher restrictions in areas in the north and areas that are not currently in Tier 4, they will rise to very high levels of disease and hospitalisation, similar to those seen in London.
The NHS Chief Executive's annual thank you message to staff acknowledges that this year has been the toughest that most can remember. But there's hope too.
By late spring, we think that with vaccine supply continuing to come on stream, we will have been able to offer all vulnerable people across this country this COVID vaccination.
3 weeks ago, Margaret Keenan became the first person to have a COVID vaccine outside of clinical trials. Today, she's had her second booster dose, a real piece of good news. But now millions more need to be vaccinated too. Catherine Burns, BBC News.
Well, 1,500 military personnel are to help with the rollout of mass coronavirus testing in schools in England next month. They will hold online advice sessions and give telephone guidance to staff, with children mostly carrying out the test themselves. But teaching unions say that schools have not been given enough time to make plans, and some head teachers are calling for the government to delay the start of term. Our political correspondent Damian Grammaticas has the story.
Empty classrooms now, but will it be safe if millions of children start filling them next week? Or could these become incubators for the new, more infectious strain of COVID-19? The current plan is for a staggered return with mass testing of secondary pupils and staff. In many cases, children themselves carrying out the tests under supervision.
It's not going to be easy It will be difficult. We are in a national emergency, but it will make a huge difference to teachers and children, and hopefully mean that schools will remain open.
The government wants children back. Homeschooling for many isn't viable, lacking the support and the space, the computers and iPads to make it work. But scientists, unions and head teachers are all urging a delay. For now, the idea is that the military, who've already been running testing, will help, not in schools, but remotely, giving guidance online or over the phone. And the plan envisages less than one soldier per school.
We're educationists. We can support the government. It's good we're going to have some members of the army, but for 3,500 secondary schools, 1,500 troops doing webinars probably isn't the government response that we were looking for.
In some parts of the UK, the return to school is already happening later. In England and Northern Ireland, children are due to start next week. In Wales, most should be back by the 11th of January. In Scotland, it won't be before the 18th. Many head teachers want more time to prepare.
Things have just come through to schools very late, and I think it's certainly led to a lot of stress and a lot of panic over the Christmas holidays to try to get people recruited. Our community have been excellent since we've had press coverage, and since we've talked to our community. We've had some volunteers, but we've still got nowhere near enough.
Schools have stepped up right the way from March, delivering online learning, turning things at the turn of a coin. We're very used to being adaptable. We really want this to work, but we don't know where we're going to get the volunteers from.
If there is a delay, primary schools and children of key workers may not be affected. But in secondaries, it might mean online learning or even an extension to the holidays for a week or two, then those taking exams back first. An announcement could come as soon as tomorrow. Damian Grammaticas, BBC News.
Well, let's take a look then at the latest government figures, and they show that there were 53,135 new infections recorded in the latest 24 hours. But not all of the four nations reported the full set of data over the Christmas period. The average number of new cases reported per day in the past week is now 38,936. 414 deaths were reported. That's people who died within 28 days of a positive COVID test. It means on average in the past week, 466 deaths were announced every day. And it takes the total number of deaths so far across the UK to 71,567. And with me is our health correspondent, Catherine Burns, whose report we saw a little earlier. So we have this record number of infections today, Catherine. And tomorrow, of course, we're looking ahead to the announcement on tiers in England and possible changes there. So where do we stand, do you think?
Well, let's start with those numbers. Those number of people testing positive, 53,000. I mean, there was, yeah, like you said, there was a bit of a lag over Christmas with some nations not reporting their data as quickly. But let's be very clear about this. Public Health England says this is a real increase and is of extreme concern. And there are some things that we just don't actually have an accurate picture of right now. For example, how many people are being treated in hospital for COVID? So the latest figures we've got, just over 21,000, they're a week old now. And at that point, we were just a few hundred cases shy of reaching the level we got to at the peak back in April. Now, since then, England's had an extra 2,000 cases. So it's pretty reasonable to expect that we have now broken that record. We've gone past that peak, which obviously is another record that nobody wanted to break. So where does all this leave us? Well, we know the government has, Boris Johnson, he chaired a meeting tonight looking at the tier system in England, and we're expecting an update from the Health Secretary, Matt Hancock, tomorrow. So right now, we've got about 40% of the population in England in Tier 4, the highest level of restrictions. And some people are questioning, is this going to be high enough? Another thing that I think we should look out for tomorrow is areas where there are really high numbers of people testing positive, but are still only in tiers 2 or 3. So an example of that is Eden in Cumbria. It's having about 500 cases for every 100,000 people right now. And to give you some context, the UK average is more like 400. But really, for all of us, no matter what tier we're in, what level of restrictions we're looking at, right now, it's time to go back to the basics. Stick to the rules for the area that we're in and go back to those basics. Washing hands, social distancing, wearing masks, everything to give us a fighting chance to get these infections down.
Catherine, once again, many thanks. Catherine Burns there, our health correspondent.